Hello, welcome once again to another edition of Dr. Aid. Today we're talking about one of the causes of respiratory distress. Many people report to the emergency with difficulty breathing, and there are myriad of causes. The month of May is quite important for some of the symptoms of respiratory illnesses, and today we're talking about asthma. Asthma is a chronic obstructive airway disease characterized by severe inflammation of the airways, often resulting in difficulty breathing of varying severities. In some individuals, it's quite mild, in others, it's quite serious. Some symptoms include difficulty breathing of varying severity. With individuals, sometimes having difficulty completing sentences in one breath. There is severe chest tightness, there is wheezing, and sometimes it may or may not come with a fever and other constitutional signs. There are so many trigger factors when it comes to asthma. Commonly are allergens, and it's always good to know what you are allergic to. So some are allergic to dust, animal dander, and even smoke from tobacco. There are also irritants like fumes, strong scented perfumes, and even the weather changes could also trigger an asthmatic attack. Very cold weather situations sometimes could trigger an asthmatic attacks, and even exercise. Some individuals have the asthma triggered just when they engage on some rigorous activity or whenever they exercise. Such individuals are advised to take in some exercise inhalers to help minimize such an attack. When an individual presents in hospital in such a condition, the doctors will obviously examine this individual. Obviously, this person will be very dyspneic, having difficulty breathing. When you examine this patient's chest, you will see that there is some noisy breathing. You hear a sound which we call rhonchi. Then the air entry may also be reduced, and you find out that when we check the patient's oxygen saturation, it will be markedly reduced. Sometimes it is precipitated by an infection, so the person may also have some temperature. When you listen, there will be reduced air entry. When you do a chest X-ray, also you find some signs of a pneumonia. So now, with regards to prevention, stay away from all allergens, stay away from all trigger factors, and always have your medications with you. Eat healthy, stay hydrated, and staying hydrated as well. It also helps to lighten the mucus and also prevents an exaggerated airway obstruction. Eat healthy and also regular exercise. Bearing in mind that certain exercise could also trigger your asthma. So we also want to also encourage or learn more of the breathing exercises to also help expand your airways. So with regards to the management, it involves compliance with the healthcare provider. There are medications that are given to relieve these symptoms. The patient is also put on some inhalers to prevent a future attack and also control whenever there is an attack. They also put on some anti-allergic medications to also help prevent future attacks. In conclusion, I would like to call on the general public not to discriminate individuals who have been diagnosed with asthma, as this is a chronic condition that is triggered by so many factors. Let us form a social support system and help minimize the triggers that could always normally tip individuals into having an asthmatic attack. The World Asthma Day is a day for us to remind ourselves of this chronic airway disease and put in measures to help alleviate this condition, and also individuals who have been diagnosed with it have a better quality of life. Till I come your way again with another interesting edition of Dr. Aid, I am Dr. J, your Dr. Aid for today.